Tonight, a dramatic twist after the death of a patient at our state mental hospital. The ABC 15 investigators have a scathing report from federal inspectors. It outlines major problems, including deficiencies that may have led to the death of a 23-year-old man.
A 46-page report from federal inspectors. Inside, he's listed as patient number 2. But his real name is Christopher Paul Blackwell. His mother says he was just 2 weeks from his 24th birthday.
His voice is gone. He's gone. And all I have left is a big old hole.
Chris was a 1-to-1 patient at the Arizona State Hospital, known as ASH. That means he should have been watched around the clock to prevent him from swallowing harmful objects. But at least 5 times in the past year, Chris ingested something dangerous. The Fed's report reveals on September 6th, just 4 days before he died, Chris was taken from ASH to the ER. A CT scan indicated he swallowed pieces of a broken CD. The Feds say when Chris returned to ASH the next day, medical staff rules and regulations dictate he must be examined by a physician. But a doctor at the state hospital admitted to inspectors Chris was never examined. 2 days later, September 9th, Chris collapsed. He died the next day from a severe stomach infection.
I feel there's a lot that needs to be exposed.
Donna Baird believes her son's death was unnecessary, and the feds found the hospital failed to provide Chris with quality care and that his life was endangered. But Chris Blackwell wasn't the only one. In the past few months, inspectors say the hospital failed to protect 5 other patients just like Chris, who all required 24/7 monitoring. Another example, on July 13th, a patient was able to remove a protective helmet and bang his head repeatedly without anyone watching him. The same day, a suicidal woman was able to take a sharp object, hide under her blanket, and cut herself. Experts like Dr. Mark Wellick, who's run a psychiatric hospital, say that's unacceptable.
It's a hostile environment. It's an environment that's dangerous for patients and for staff.
Inspectors also found systemic problems with nursing care. Time after time, the hospital failed to meet required levels of staffing. That's a problem the ABC 15 investigators first exposed in February.
There's many days I will be on the floor alone. Other staff members will be on the floor alone.
After we reported staffing shortages, the hospital hired temps to fill the gaps. But that's where feds discovered another failure. Temps were assigned to work with some of the most dangerous and needy patients, and hospital officials put temps to work without knowing if they were qualified or competent. In 4 cases, the feds found temps let patients hurt themselves or others.
And obviously this needs to be fixed.
After seeing our stories, Representative Chad Campbell wanted answers and met with top hospital officials.
They gave us this rosy picture that everything was great, everything was fine, and that's obviously not the case.
Mr. Hummel, Dave Biskobing, ABC 15. Do you have a quick second for me?
The head of the state health department has ignored or declined repeated requests for an interview.
I think it says that there's something they're trying to hide. If they lose this certification, that's $6 million that we're going to have to fill with Arizona taxpayer money.
Like you just heard, if certification is pulled, that means Arizona loses out on millions. Now, even though hospital officials won't talk to us, their plan of correction is included in this inspection report. So far, the feds are still reviewing their plans. I'm investigator Dave Biskobing, ABC 15 News.